Good afternoon and welcome to Cut to the Chase with Senator Chase. Welcome to our weekly call-in town hall and radio show, and I invite you to call in today. It is a call-in town hall. The number is 804-454-1366. That's 804-454-1366. This is a call-in town hall. I'm your state representative. I represent you all in the state Senate. I represent Chesterfield, Colonial Heights, and Amelia, most of Chesterfield, which I share with Senator Sturdivant and Senator Dance. And it's an honor to be on the air and hear your calls, hear your concerns, and feel free to call in at any point during the show. I always like to give a thank you to WNTW for the opportunity to provide this free public service to you each week. It is a unique opportunity for you. I don't know that many of my other colleagues in the Senate have been afforded such a unique opportunity, so I hope you'll take advantage of it. And I like to invite them to come on the show from time to time so that you can hear from different perspectives from a number of legislators that I work with in the state Senate. As I mentioned, I'm State Senator Amanda Chase, your weekly radio show host. And for those of you tuning in for the first time, I actually don't work in D.C. My office is actually at the state capitol in downtown Richmond. And one thing that I like about working at the state capitol is we actually get a lot of things done. For one, by law, we have to balance our budget. So we have a state budget every year, and this will, coming January, we'll begin that process as we begin our long 60-day session. Now, I know that officially we work 60 days coming up this session. Last session, we worked 45 days, and we take turns depending on the year, every other year. And this is still my first term in office, and I am getting ready to complete my third session. So I'm starting to feel like a veteran, right? Halfway through my first term. So I'm a Christian conservative, Republican, and in that order. And Vice President Mike Pence used that line. I liked it so much that I like borrowing that line from him. I ran on term-limiting career politicians and returning the government back to the people. And my goal has to be a representative who is transparent, accessible, and approachable. We want to change that culture where, I know people are so frustrated with politicians. I know a lot of times when I meet people and, they ask me what I do and I tell them about our small businesses. And then I mention that I'm a legislator. It's you might as well tell them you have leprosy. And then you start from there and work your way up to try to convince them that you're there fighting for the people. I mean, politicians don't have a great reputation out there right now. And, a lot of people are angry, and quite honestly, rightly so. I was so angry I ran for office. So you can do that too. So I did run on term-limiting career politicians. I think it's important that we return the government back to the people. I think many times politicians lose touch with their constituents, and I really appreciate the opportunity to do this show because it gives me the opportunity to hear from you. And again, 804-454-1366 is the number, and you can call in today. I'm actually not paid to do this show. A lot of people think politicians make a lot of money. The state legislature, we don't at all. In fact, I would say our wonderful teachers who should be paid more than what they are paid actually make a lot more than we do. But we don't do this for the money. We do this because we feel like it's important to, in my case, return the power back to the people. And I'm just thankful to be here. I do this because I think it's important to stay connected to the people that I serve. And a lot of people say, well, do you get anything done? Actually, we have. Since I've only been in office, I was elected in 2015, officially started January 2016. And since being in office, I've actually pushed for greater transparency to change the culture, even in the state legislature. And I'm proud to tell you that for the first time ever in Virginia's history, this coming session, you will actually be able to go on your laptop, your computer, and see live stream our committee meetings, which, like I said, this has never been done before, but the Transparency Caucus wrote a letter, and we got our colleagues to sign on to this, and asked the clerks to make sure this is done so that those of you working can still follow bills that are important to you. A lot of times people, if they do tune on, or you're looking at the major networks, you'll see us voting on the floor of the Senate, and you'll see the votes and everything. Most of the work is already done at that point. And you're really missing out on a lot of the discussions and the good interaction there to kind of explain both the pros and cons of a particular piece of legislation. So that is one thing that I feel really good about in accomplishing for the people of Virginia. Another big event was this past Friday. There was actually a almost 800-page study that was returned to myself and Senator Serville for our coal ash disposal bill, which we will be talking about this coming session. It was a bill that was signed into law and passed, and the bill was due. It was homework for Dominion that we had returned to us this past Friday, and we're looking over that. It's an 800-page document with a 14-page executive summary, so we'll be doing a lot of work over the weekend as we decide what to do with all of this coal ash that we made it. All this electricity, every time we turn on our light, turn on our laptop. In Virginia, we have over 50, and even in Chesterfield County at our Chesterfield Power Plant, we have over 50 years of coal ash sitting there in a 100-year floodplain right next to the James River. And so we've got to decide what to do that and do it in a fiscally responsible way. So we do get things done. We won't go into all the detail on that. Just a reminder, I do serve on 4 committees in the Senate: Health and Education, which makes sense because I have 4 kids, 2 who are still in our public school system; Transportation, Local Governments, and Privileges and Elections. And as I mentioned earlier, I co-founded the Transparency Caucus, and that is a bicameral, bipartisan caucus. And I'm really excited about that caucus. We're able to get a lot of things done. And in this session, we're going to be pushing to get in the House. They have in committee meetings what are called voice votes, where you can't really tell who voted for what, but it's just there's really no accountability there. In the Senate's a little bit different. We actually do have recorded votes in our committee meetings. So Delegate Mark Levine and I will continue to strive to get more transparency in the legislature, and so we'll keep giving you progress reports on that. So many of the topics that we address on our show, they are actual real-life issues that you all have brought to my attention, or issues that we've addressed in the General Assembly. And from time to time, we get congressional upgrades from Virginia's congressmen, specifically Congressman Dave Brat, who is my congressman. And so today, we're going to be talking again about Medicaid expansion. I talked a little bit about that last week and just kind of ran out of time. So I really think it's worth our time here today to talk about that. Before we start, because we're going to be going to break in just a little bit, I want you to know you're getting your money's worth out of me. In the last week, I've enjoyed spending a lot of time with you all in Amelia. I was at the Amelia Christmas Parade. I was at the Colonial Heights Christmas Parade. I attended the Richmond Realtors reception this past week. This morning, I was at the Midlothian Business Alliances. I am really, honestly, did Christmas with a cop at the Walmart in Chester with our fraternal order of our police. So if there is an event or group gathering that you would like me to come participate in or speak in or what have you, or come and listen. I love to just come and listen. This morning, I been talking to you all about my healthcare cost transparency bill, and got some more great additions to that bill just by sitting after the meeting with the Midlothian Business Alliance and talking to one of the members there about some of their concerns. So you all helped me come up with the best bills. All right, so let's get started here. As I said last week, healthcare is the number one issue that is important to Virginians according to the exit polls. And just those of you who have called my office and when I'm out in the community, everyone's telling me They're really concerned about health care. More and more Virginians are not able to afford quality health care. And those of you who've been with me for the past year and listened regularly know we started in the summer warning people about what was going to happen on January 1. Do you remember this? Initially, Optima and Anthem had said they were completely pulling out of Virginia's market so that if you were under the individual plan under the AFA or Obamacare, that you would not have any health care. And fortunately, we're no longer in that situation. They have come back to the markets, but premiums have gone up 50, 60%. So we're going to talk about that when we come back from the break. Health insurance is becoming increasingly more affordable for most families, and we want to come up with solutions. So stay tuned. We'll be right back.
Lately, I've been losing sleep, dreaming about the things that we could be.
Boy, that's an appropriate segue here for this next segment. I know a number of you are losing sleep at night just thinking about rising healthcare costs and the premiums associated with those. And, what are we going to do about that? First of all, I just want to dispel some myths because, there's a lot of, to put it politely, myths that are out there. I want to talk to you. Now, some of you may be saying, Medicaid, what is that? It's a program of medical aid. And honestly, it's designed for those who are unable to afford regular medical service. And it is financed by both the state and the federal governments. The other term that you're going to hear a lot about is Medicaid expansion. And that refers to the expansion of the Medicaid program through each state. Many of you have heard of the Affordable Care Act, also affectionately called Obamacare. And it will establish a minimum income level to be eligible for the financially weakest people in America through creating a minimal Medicaid earnings eligibility level requirement. So that's a little bit about what we're talking today. Now, some of you have health insurance through your private, your employer, but this is all basically what we're looking at this coming General Assembly session. Because of the change in the House, the amount of turnover in the Republican House, we're going to only probably be up by one in the House, hopefully still retaining our majority. But the Governor Northam is going to be pushing for Medicaid expansion again. And what I don't want to happen, I want to prepare you so that you're inoculated with the facts, with the truth. Because it's I'm very sympathetic to people that have needs and special needs. A lot of times people think that those people who are on Medicaid are those who are actually able to work and they just won't get off the sofa and go to work. That's actually not the case, actually. Is it people just living off the system? Let's just get them off the system and maybe we can save some money that way. Now, I know, and we'll talk about it in a minute, there is some fraud that takes place. In fact, quite a bit. In fact, under Attorney General Ken Cuccinelli, we found a lot of Medicaid fraud going on. And so I'll be completely transparent on that front. But you may be surprised to find out that it's mostly women and children who are on Medicaid in Virginia. And actually, most of the children are severely disabled. They have intellectual or physical disabilities and challenges. And a number of them come to my office, the ones that can, and those that don't, their parents come. And, I'm a mom of 4 kids, and my heart goes out to those who, I know one of my closest friends, she stays home with her oldest son, who has spastic dysplasia and takes care of him, has done it since he was born. That's a financial impact to that family. And I remember whenever, the husband that he's the sole provider of their family and got laid off from his job a while back. And it was a very tough situation. We all can give an example of or a situation where there's someone that we know that due to no fault of their own, they need some type of real help. And we see legitimate needs going unmet. And there's one thing that I really want to emphasize today is there's something called Medicaid waivers. There's Medicaid waivers and Medicaid expansion. And what I want to talk to you about is Medicaid waivers. Medicaid waivers can be given to increase the number of children or women who have these legitimate needs. We can already expand that. In fact, we have voted. I voted yes to expand these Medicaid waivers to cover these children. And that is not the same as Medicaid expansion. Medicaid expansion is something completely different. And Medicaid expansion is forcing people, whether they like it or not, to buy insurance. Okay, and I just feel like that is a violation of who we are as a nation, as a country, to force people to buy something. I just think it's fundamentally wrong. I think it's legalized extortion, especially when we require these small mom and pop shops who want to expand their business, but once they hit, I think it's 29 employees, they have to pay additional insurance and so forth for their full-time employees. And I know some close friends of mine who have actually limited their growth and not hired people that they should, or turned their full-time people into part-time people, because to stay in business, they had to do it because they couldn't afford it and have some type of profit. So we have to look at this, and let's just go back to one little thing here. Let's just say in states where, like Virginia, if your income is low and your state hasn't expanded Medicaid, you won't qualify for insurance either. Your income is below the federal poverty line. You don't qualify for Medicaid under your state's current rules. You won't qualify for health care insurance, the health insurance savings program. And in fact, Medicaid coverage or savings on a private health plan are bought through the marketplace. So, and why is this? Because it only covers incomes up to 133% of the federal poverty level. Okay, so let me simplify this. So when the health care law was passed, it required states to provide Medicaid coverage for all adults age 18 to 65. And they had incomes up to 133% of the federal poverty level, regardless, it didn't matter what their age was, what their family status was, or their health. Okay, so fully paid for. The law also provided for those who just needed some help to purchase private insurance, okay? So the law provided premium tax credits for people with incomes between 100 and 400% of the federal poverty line. So they got a little bit more income so they can actually buy private insurance plans in the health insurance marketplace. However, the U.S. Supreme Court later ruled that the Medicaid expansion is voluntary with states, and as a result, some states like Virginia have not expanded their Medicaid programs. Adults in these states with incomes below 100% of the federal poverty line and who don't qualify for Medicaid based on disability, age, or other factors fall into what is called as a gap, because their incomes are too high to qualify for Medicaid in their states, and their incomes are below the range that the law set for savings on a marketplace insurance plans. Now, states are continuing to make coverage decisions, and they could expand Medicaid in the future. But there is an answer for Virginians if you don't qualify for either Medicaid or marketplace savings. Did you know that you can actually get care at a nearby community health center? That's right. They're called HRSA health centers, and I did a little search and found there's one near me in the Bermuda Medical Center, which is in Chesterfield, Virginia, on Bensley Commons Boulevard. Okay, because some people say, okay, we did not in Virginia expand, so my loved one is going to die. I mean, that's what they were saying at when Congressman Brad and I had a town hall. They're like, my loved one is going to die because you're not expanding Medicaid. Well, that is not true, my friends. There is a nearby community health care center. Stay tuned. We'll be right back. This is State Senator Amanda Chase on Cut to the Chase with Senator Chase, and thanks for tuning in today. Today we're talking about community health care centers. We're talking about Medicaid. What happens if Virginia decides to expand Medicaid? What are some potential better suggestions and offers? And I'm actually going to be filing legislation to address this very issue that I think is important to all Virginians. But I do want to let you all know that about these community health care centers. The health care law has expanded funding to community health centers, which provide primary care for millions of Americans. Did you know about that? These centers provide services on a sliding scale, and it's based on your income. So you can actually, you could just do a Google search, community health care centers, and up it'll pop. They're called HRSA health centers. Now, I know you all are probably driving and not able to write that down, but just think community health center, CHC, okay? Remember that. So even if you have no health insurance, you pay what you can afford based on your income. Now, health centers provide services that include checkups when you are well, treatment when you're sick, complete care when you are pregnant, and immunizations and checkups for your children. Some health centers also provide mental health, substance abuse, oral health, and or vision services. And you can contact the health center organization directly to confirm the availability of specific services and even to make an appointment. Now, if you don't have any coverage, you don't have to pay the fee. Under the law, most people must have health coverage or pay a fee. But you won't have to pay this fee if you live in a state like Virginia that has an expanded Medicaid, and you would have qualified if it had it. And this is called, and I want y'all to memorize this, exemption from the fee. You can get an exemption when you apply for coverage in the marketplace, or you can apply for the exemption without even having to fill out a marketplace application. If your expected yearly income increases so that you fall between 100% and 400% of the federal poverty level, you can actually become eligible for a marketplace plan with advance payments of the premium tax credit. In this case, you may qualify for a special enrollment period that allows you to enroll in a marketplace any time of the year. You must, however, contact the Marketplace Call Center within 60 days from the date your income changes to request what's called the SEP. When you call, and you need to attest that you, number one, weren't eligible for Medicaid when you first applied because you lived in a state that hasn't expanded Medicaid. Two, you weren't eligible for a marketplace plan when tax credits when you first applied because your income was too low. And then finally, you had an increase in expected yearly income that now qualifies you for a marketplace plan for tax credits. So let's go back to what I was talking about earlier, the difference between Medicaid waivers and Medicaid expansion. You know, the state currently assists those with severe intellectual and physical disabilities. However, there is a fixed amount of money that the Commonwealth allocates. You know, you all remember that we by law must balance our state budget. And there will always be a set amount of money to help in certain situations. But this is very different at the federal level. There has typically been no cap. Instead, we have increased our national debt to pay for these federal subsidies. And the problem is that the cost of health care only continues to increase, and the number of mostly children who need the help is increasing. We've seen a major spike, like quadrupling the number of kids with autism. These exponentially increasing costs have made the program unsustainable. And, you know, I always go back to, you know, what is the major problem we have here? And it has to do with health care costs. And what are we going to do to get those costs down? You know, let's just say, you know, you're a supporter of expanding Medicaid. Well, you're still going to have to deal with who's going to pay for those costs. And honestly, it's going to be you. Because when you say government, point to yourself, because it's taxpayer money, and who's paying the taxes? It's you. So it's important that we address healthcare costs. And just a couple things, because these are the arguments that I'm hearing for supporting healthcare expansion out there. Number one, they will tell you, supporters of Medicaid expansion will tell you that we must expand Medicaid in Virginia because they think healthcare is a basic human right. Every Virginian deserves or should have access to healthcare, and the government should pay for these federal subsidies no matter what the cost. Currently, by law, our emergency rooms across Virginia must treat everyone who walks in their doors. It's called charity care. It was supposed to be a system used to see those needing urgent care, but now it's become the doctor's office for those who are uninsured, bogging down our system designated to treat those who need urgent care. Stay tuned when we come back. We've got a full slate of discussion ahead of us, so stay tuned. You won't want to miss this.
I can't lean on earthly things 'cause broken.
Welcome back to Cut to the Chase with State Senator Amanda Chase. And we're talking about healthcare expansion. To expand or not expand? That's the question. And what do we do if we don't expand? We still have this growing need every day as more and more people say, I can't even afford this healthcare insurance. What am I going to do? I mean, to be a responsible parent with children, we are taught we have to provide for our families. And what are we going to do when we can't afford it anymore? And many of you are already raising your hands out there and saying, that's me, that's me. Yeah, I've been talking to people a lot about this issue. It's why I want to talk about it today. And I will tell you, the place of last resort and is the emergency rooms. And our emergency rooms, I've gotten to know the CEOs of the local hospitals here, and I know Chippenham is actually expanding their emergency room to meet the high demand of charity care. You know, what was supposed to be a system used to see those needing urgent care has become the doctor's office, unfortunately, for many who have no other choice. So let's talk about a second argument that we hear a lot about. Some supporters of expanding Medicaid say that Virginia is sending taxpayer money to other states that have already expanded Medicaid, and that Virginia is simply leaving millions of dollars on the table. In fact, if you want to get the exact number, they say $14.7 billion are on the table. But let me tell you what they don't tell you. The states that have expanded Medicaid have found that more people enrolled than what was originally anticipated. And by the way, the cost is way more than first anticipated, causing a financial crisis for state governments that have expanded. And I've got some examples here for you. Massachusetts, Ohio, Arkansas, Illinois, Kentucky, Michigan, Washington, West Virginia. And what are they saying? You know, in Massachusetts, it says that as the federal government no longer covers the total cost of expansion, Massachusetts said it needs to slim down the program because the costs are unsustainable. And they've already expanded. They say that now Medicaid is 40% of the Commonwealth's budget. Wow. Let's take a look at Ohio. They were talking about in Ohio, there was an enrollment explosion that resulted in $2.7 billion of budget overruns in just the first 2 years of the program. In Ohio, $1.5 billion over budget for Medicaid expansion program in its first 15 months. Obamacare expansion enrolled 243,373 more people than projected and ran $1.5 billion over budget. We see this time and time again. Arkansas, $730 million over budget. And the big concern for them, they said it was primarily the prescription drug area. I won't go through this whole list, but that's the problem here. This is devastating to a state budget. Devastating in all these cases. I'm looking at each of these states right here. We have to balance our budget in Virginia. Most don't want to pay the high deductible for routine preventative health care, so they don't go to the doctor. So they're paying for health care insurance, and they are financially disincentivized to actually use the insurance. I've told you all, I think it's promoting legalized extortion, forcing Virginians to buy something they may or may not want, because you're paying for health care insurance premiums and health care in addition due to the high deductible. Just think about it. You're paying it month after month, writing that check, and it's not cheap for that health insurance. But now you decide you need to go to the doctor. Let's say I know my kids played football. We always had to get these exams every year before they could play football. Well, you're going to pay out of pocket for that until you meet that high deductible. And in some cases, it's $5,000. I've heard other stories. And you're looking at your spouse and you're saying, I thought we had health insurance here. This is ridiculous. We're paying both. We're not only paying for health care insurance, but we're paying this astronomical amount for just things that we used to could pay, $20 for. It's just out of control, honestly. Okay, so let me get to my solution. There's a couple things. There's currently something called healthcare sharing programs. They are medical cost sharing plans. They are out there. One of my friends, who's very super smart, actually included that back when Obamacare was being written up as an exemption to Obamacare. It's healthcare sharing programs. I know John Fredericks talks all the time about the Liberty healthcare sharing program. There's the direct primary care bill that I was actually a co-patron on that passed this past year, which I'll talk about in a minute. Last week we talked about a bill that we'll be looking at this year called the Right to Shop bill. And then I have another bill called the Healthcare Cost Transparency bill. And I'm going to talk a little bit about that today. In every other industry, the cost before you choose to buy, except for in healthcare. You go buy an automobile, there's a sticker price right there on the window. You go to Walmart, you can see how much a basketball is going to cost. Healthcare is the only industry that I know of that doesn't consistently, as part of best practices, provide what the initial cost of services before you enter in and have the services done. I was in the doctor yesterday. They just wanted my insurance card. They didn't tell me how much it cost. They're like, we're just going to bill your insurance and you can pick up the tab, whatever's left. I can't tell you the number of people who come up to me and say, yeah, this is a problem. If you could fix this, this would be great. So if you have insurance, you're asked to sign the dotted line saying that you're going to pay whatever health insurance doesn't pay for, and most of the time you have no idea what the estimated cost of services is. Now, would you sign a blank check and give it to your doctor? That's basically what we're doing. And I want to give the patient or consumer the opportunity to know how much before they commit to the services, which will allow you to compare and shop services, right? Because if you get a estimated cost of services from your doctor and you're like, whoa, we can't afford that in our family budget right now, and you have the ability to go to another doctor and say, hey, what would you charge for this service? So I think it's going to give you more options. Also, the doctors that should like this, I hear doctors complaining all the time that practicing medicine is no longer rewarding anymore. Why? Because insurance companies are dictating to the doctors what they can and cannot do. Ultimately holding our doctors hostage to a broken system. Cost is the single biggest obstacle that's preventing most people from being able to afford health care on their own. Notice I said health care and not health care insurance. Health care is very different. Health care insurance is something you pay, but you may not get health care just because you have health care insurance. If there's anything Obamacare has taught us, it's that you can have health care insurance and still not have health care. And this is coming straight from the constituents in my district who signed up for health care insurance under the individual plan. The deductible is so high that consumers end up paying the cost, not only the monthly cost of the health care insurance, but they also pay for most health care anyway because the deductibles are so high, as we mentioned earlier. We've only got a few more minutes. We're coming back to the final segment of Cut to the Chase with Senator Chase. We'll be right back, right after the break. Welcome back to the final section of Cut to the Chase with Senator Chase, and this is State Senator Amanda Chase at your service here. And we are talking about Medicaid expansion. Should Virginia expand Medicaid? And if not, why not? And if we don't, what do we do about health care in Virginia? Well, we do have some answers, and it may take me several weeks to get through all of this material, but there's a lot. But there is, some interesting studies here that I want to share with you about how Medicaid actually harms the poor. I don't know if you saw the study, but the largest such study by far was conducted by surgeons at the University of Virginia. And they examined the outcomes of 893,658 individuals undergoing major surgical operations. And this was from the year 2003 to 2007. And it found that the patients on Medicaid were, get this, 97% more likely to die in the hospital after surgery than those with private insurance, even when adjusting for age, gender, income, region, and health status. But get this. This is incredible here. Medicaid patients were 13% more likely to die than those who were uninsured. According to this study, you are better off being uninsured than being under Medicaid. Now, why is that, you say? This is because the Medicaid program pays doctors and hospitals far less than private insurance do, leading many doctors to drop out of the program entirely. And in fact, in 2008, the Virginia Medicaid program paid doctors 29% less than private insurers did. In states with expansive Medicaid programs like California, New York, Medicaid pays doctors 62 to 71% less. Now, I want you to ask yourself, would you be willing to do the same work and make 62 to 71% less, get paid less? When Medicaid patients can't get predictable access to care from physicians, their cancers go undiagnosed, their heart conditions go unmanaged, Virginia should instead insist that Washington provide more flexibility with Medicaid spending so that the Commonwealth can provide them with dignity, and our goal is to have private insurance. Medicaid's access problems will continue to get worse as more doctors drop out. According to the Urban Institute, there is a considerable concern about whether there will be enough doctors to even see the influx of new Medicaid patients. It seems unlikely there will be increases in permanent participation among privately practicing physicians with the temporary increases in federal payments for primary care physicians for 2 years. It's one of the biggest problems in Virginia, and we're going to continue to address this. There's so much more that I want to cover on the topic, but I want you all to be prepared. I mean, it's important to know the facts. It's important to know really what's going on with Medicaid. Is it something we should expand? And if we do expand, what are the consequences associated with it? I don't support Medicaid expansion. I think maybe we should look at some waivers, but I think we have some other alternatives here. So stay tuned. Cut to the Chase with Senator Chase, and we'll keep exploring this very sensitive project that affects all Virginians.